Psychological well-being is a dynamic concept that includes subjective, social, and psychological dimensions, as well as health-related behaviors. Life satisfaction is like a state of mind, just like sadness or happiness. Our general objective is to compare the psychological well-being and life satisfaction of different departments in CRS. While our specific objectives are to determine the perception of past, present, and future life between male and female, to determine the type of social relationships established between different sections in CRS, and to determine the insight of each participant as to self-acceptance, personal growth, and purpose in life. It is a descriptive study design. Fourth-year students of physical therapy, occupational therapy, and speech-language pathology, and third-year students of sports science of College of Rehabilitation Sciences were asked to take a survey. That is a total of 266 students. The survey was conducted in the University of Santo Tomas in the College of Rehabilitation Sciences. The fourth-year PT, OT, and SLP and third-year SPS students were told to take the online survey, whose answers were then compiled and subjected for study. For data analysis, we use descriptive statistics. As seen in the graph, the male students garnered higher scores on the three sections of the questionnaire. In general, both the gender scores fell under the high score category of the questionnaire scoring manual in the present and future domain. Having a score between 25 to 29 would mean life is enjoyable and the major domains of life are going well. However, on the past section of the questionnaire, both have an average score of 24. This means that the group is considered normal in that they have areas of their lives that need improvement. As seen in the chart, on average, the students generally have warm, satisfying, trusting relationships with others, is concerned about the welfare of others, capable of strong empathy, affection, and intimacy, and understands give and take of human relationships. 3 SPS garners the highest average, while 4 PTB with the lowest. The highest possible score would be equal to 21, and the lowest score is 3. With a median score of 12. There is no definitive criteria to categorize or distinguish the scores other than being the lower scorer or higher scorer, which would mean there is no fine line to separate the two divisions. Based on the graph, there is no significant difference of scores between the age groups of the students in the self-acceptance section of the questionnaire. If we are to consider that the highest possible score would be again 21, the lowest score equal to 3, and the median being 12, then we could still say that the students scored higher, signifying a positive result. In the psychological well-being and life satisfaction scale, the participants, the students from College of Rehabilitation Sciences, generally report empathy, positivity, and self-acceptance. In the temporal satisfaction with life scale, it should be noted that both genders report a massive growth in positive outlook for their future. Both genders anticipate an ideal and excellent prospect, expecting more important events to happen in the future. In the positive relationship scale with others, all major sections among all CRS programs have warm, satisfying, trusting relationships with others, is concerned about the welfare of others, capable of strong empathy, affection, and intimacy, understands give and take of human relationships. It should be noted, however, that the sports science students have the greatest affection for others. Finally, all participants generally affirm self-acceptance, pleased with themselves, their opinions, and personality. The implication of the study is that with empathy, positivity, and self-acceptance, CRS students are ready for interprofessional collaboration with other medical specialists and patients.